So simulation has been widely used to great effect in many high-risk industries and is well validated in a number of medical disciplines. As we gather here to discuss standardization of training methodology, introduction of surgical virtual reality simulator deserves a mention. Good stereo acuity, spatial awareness, precise hand-to-eye coordination, and ability to use all four limbs simultaneously are the quintessentials for performing an uneventful intraocular surgery. So historic take on cataract surgery training has involved experimental models and wet lab training, as sir has already covered, on animal or synthetic eyes, which were highly unstructured, it allowed only rehearsal of few steps of cataract surgery, and it lacked any form of objective assessment. So increased focus on proficiency-based training in surgical disciplines led to a demand for objective assessment tools. Virtual reality surgical simulator is a computer-based simulated environment with high-performance computer graphics and a specialized software which provides visual, tactile, and auditory feedback simulating a true life environment. The Hark Street simulator is by far the most investigated in ophthalmic practice, and it has been recently procured at 2 of our army centers. And it comes with a mannequin head which can be used in 2 orientations, that is superior and temporal. The instruments contain colored heads from which optical tracking systems convert movements to electric signals and are relayed to the simulator after being inserted into the eye. Therefore, all necessary instrument types can be recreated inside the eye. And as in real life operating situation, there are 2 foot pedals, one to maneuver the microscope and the other to control the fluidics. Looking through the microscope, the trainees experience interaction with tissue and intraocular structures which are simulated in real time. The interface which comes with the simulator follows a standardized curriculum from category A, which covers training in basic skills like depth perception and bimanual navigation, and gradually stepping up to category D, which trains in managing various complicated scenarios like posterior capsular end. So these are the tiers of training which are available in the cataract module, and it involves the basics of microscope also, which in real life scenario we ourselves have to learn in the OT. So training includes management of the ports, like we can see in this video, that how it is the ports have to be managed to avoid undue wound stress, loss of viscoelastic or diminished red reflex, to depth perception and manipulation of the instrument inside the anterior chamber.
Complications.
To highly precise surgical steps like performing capsular access. This is on the simulator. It actually looks like a real eye. And to performing nucleus management, algorithms have been finely tuned to recreate accurate tissue characteristics and thereby allow realistic simulation of procedures. It also teaches management of various complicated scenarios like using pupil expanders in small pupil cases and enlargement of small rexes, and even management of complications like posterior capsular end by teaching the steps of anterior vitrectomy. So the trainee is well equipped mentally to enter the operating theatre and facing cases in real life. So this is a side-to-side comparison between simulator and real eye, showing the steps of capsular access in a case of mature cataract. I'm sorry, the video is not playing. Okay. So basically, this is that video in which it actually it's looking really similar. That this is a real eye. We are doing capsular access in real time, and on simulator, this is how it looks. But I'm sorry, the video is not playing. So having a simulator at our center proved as a boon for us, and this is my own comparative video of capsular access in a real eye from my residency days. On the left. Actually, this is a video in which I could not even manipulate my instrument inside the eye, and my hand was covering the surgical field. But after a few months of training on the simulator, I could easily maneuver my instrument inside the eye and smoothly complete the rexes. So this simulator also comes with a vitreoretinal interface, which comes with integrated biome, mimicking functions just like real wide-angle viewing system. And these are the three tiers of training which comes with the vitreoretinal interface. The introductory tier involves basics of instrument navigation inside the vitreous cavity and usage of non-dominant hand, and gradually stepping up to teaching the complex vitreoretinal surgeries like retinal detachment or foreign body removal from the eye. So from lifting the posterior vitreous face on simulator vis-a-vis in real eye to doing it in the real eye to, I'm sorry, the video, there is video. To doing intricate surgeries like epiretinal membrane peeling on simulator vis-a-vis in real eye. And in addition to the myriad benefits of training from the simulator, it also allows the opportunity to examine other aspects of working in an operating theatre that cannot otherwise be ethically investigated without putting the patients at risk, like the effects of distraction or fatigue on the surgeon. This can also be checked with the simulator. And at the end of each task, simulator gives a detailed feedback assessment with precise pointers to refine the surgery. And to ensure reliable skill levels, trainees need to reach given score 3 times in a row before proceeding to the next task. And the evidence-based performance assessment gives both educators and residents confidence in surgical skills before operating on a real eye. There are other simulators available in the market like PhacoVision, MicroVistouch, Help Me See Eye Surgical Simulator, which differ from the one that we have at our center, that is the Hack Street one. That MicroVistouch comes with virtual mobile head, eye and instruments. So it gives the idea of actually operating on a real head and eye, which is not there with Hack Street or PhacoVision or any other simulator. And unlike other simulators, Help Me See Surgical Simulator teaches the steps of manual small incision cataract surgery, which includes scleral tunnel formation also. So since 2003, more than 60 studies have been done on application of virtual reality simulator in ophthalmology, from examining construct validity of simulator to transfer of skills to the operating room. And similar articles have been published. One of them includes by McKennell et al., which compared the results of capsulorhexis of first and second year residents who were not exposed to simulator versus third and fourth year residents who were trained on simulator, and they reported 68% lower mishaps in the trained group when performing capsulorhexis. Similarly, Ferris et al. Reported 38% reduction in posterior capsular tear in the trained group, leading to overall decrease in patient morbidity and cost reduction. But all said and done, although simulator training makes us better equipped for the operating room, the surgical pearls that we learn from our seniors in the operation theatre are irreplaceable. Thank you.
Thank you.